Please welcome Julia Manchester back to the stage, joined in conversation by Nancy Brown, CEO of the American Heart Association.
Hi, Nancy. It's so
Hi.
great to join you here today. How's everything going?
It's going well. Thank you so much.
Wonderful, wonderful. You know, you've led the American Heart Association since 2008. Looking back, what's changed most about the fight against heart disease in America?
Yeah. You know, I would say many things that are positive and some things that are of great concern. I want to make sure that the audience is aware that deaths from heart disease, cardiovascular disease, have been cut in half since the founding of the AHA in 1924. And that really has to do with many things, the marvels of scientific innovation, technology, drugs and devices reaching people, procedures. A person who has a stroke today can walk out of the hospital if they get the right access to care 2 days later, with their life almost back to normal. This is the marvel of scientific innovation, and that is really the foundation of what we stand for at the AHA, and we're very proud of that work. At the same time, people are not as healthy as they need to be, and that is a major focus of the work of the American Heart Association, so a lot of work ahead.
When it comes to heart disease, just if we could have a broad overview, you mentioned people aren't as healthy as they need to be. What factors can go into preventing heart disease?
Well, heart disease is the #1 cause of death in America and around the world, cardiovascular diseases broadly, including stroke. And there are a number of things that really matter. We call them life's essential 8. A person's ability to have access to healthy foods, live a life free of tobacco, get appropriate physical activity, and have a body mass index at an appropriate level, as well as having risk factors controlled: blood pressure, blood cholesterol, blood glucose, and most recently added to get enough sleep. And so it is a basket of things that need to come together for individuals and families that allow a person to have optimal cardiovascular health. And let's face it, the most important thing to a person in their life is their health. Mm-hmm. Because when you have health, it buys you the ticket to everything else that matters to you. Time with your family, your friends, your faith organization, being a great member of your community, a great employee. All of those things happen when you have good health, and so it really matters.
And we talk about how much it matters, but recently we've seen cuts to NIH funding, some government funding that I understand has affected the American Heart Association. Talk about how it's affected, or Heart Association, talk about how it's impacted your job and also, impacted the fight against heart disease.
Yeah. The NIH is the major funder of research in this country. Of course, we all know that. The major funder of cardiovascular disease, the American Heart Association, is the second largest funder of cardiovascular disease research in America. The cuts are devastating, or the proposed cuts and the actual cuts are devastating. If we think about the strategic advantage the United States has in the area of science and technology, it's very significant, and we're at risk of losing that. Clinical trials that are funded by the NIH, I think Dr. Besser mentioned this earlier, they're at the front end of things that each of us enjoy today. And I think often we don't stop and think about what happens in a healthcare encounter. If someone gets raced to the emergency room having a heart attack or a stroke, there's a team of professionals there that know exactly what to do. There's medications that are administered, blood tests that are given, a troponin test to see if you're having a heart attack. Arteries are opened, strokes are pulled out of your brain with a thrombectomy. People didn't just wake up one day and say, I think we'll go into someone's brain and pull a blood clot out. Yeah. Years of clinical trials and studies were at the front end of these innovations that people in this country should be so happy they have at their disposal, and we should be so proud that this is a standard of care in this country. The demolishing of scientific research will have a devastating impact on every single one of us, today and in the future. And so we're very concerned about it at the AHA.
So how have you been able to pivot over the past 8 months? How have you been able to, I don't know if there's any way to, curtail, work your way around these cuts, but what have you had to do in the meantime?
Well, just for background, the American Heart Association is a global organization. We have a presence in 110 countries. We have 33.5 million volunteers and supporters and 40,000 medical and scientific members that are part of our organization. And as I mentioned, we are the country's second largest funder of research into cardiovascular diseases, including stroke. So we, of course, focus on what we can do with our funding, which, pales in comparison to the NIH funding. And we also make sure that our voice is heard in Washington about why research matters. Research matters to every person, whether they realize it or not. And so we work very hard to bring to life the stories of patients and survivors, from young people to old people, whose lives have been saved or impacted because of research. It's really important that not get lost in the narrative. We have people's health and people's lives in our hands here, and we have to remember, a child born with a congenital heart defect today, research is the reason that now we have adults that are living with congenital heart defects that they were born with. These children didn't make it to adulthood 20 years ago. So stories really matter, advocacy really matters, and I think for the American Heart Association, because we are a science organization, we are a policy organization, and we are a grassroots organization, we're uniquely positioned to work together with our partners at Research America and other organizations to make sure that our voice is heard.
I want to switch gears and talk about women's health. Heart disease obviously disproportionately impacts women, particularly women of color. How does the American Heart Association address inequality, systemic inequality, when it comes to treatment for women?
Yeah. Women should stand up and be really mad about the fact that, first of all, heart disease is the #1 killer of women. It affects more women than the next 4 causes of death combined. People have a mental model of, older men clutching their chest and falling over with heart attacks. The thing to know is that for women over the age of 25, 45% of women already have an established risk of cardiovascular disease. And so it really matters that we do things personally to control our health. Yet systemically, there's a lot going against women. First of all, women are understudied. The symptoms of women are under-recognized in the healthcare system in America today. Women are not enrolled in clinical trials to the same level as men. And what we like to point out is many of the medications, the treatments that are broadly available to people in this country, a large proportion of those studies were done on men, not women. And so we must stand up and be advocates for our own health as women. And at the American Heart Association, that's what we do through the Go Red for Women campaign, a campaign that we launched more than 20 years ago to help women, take action for their own heart and the heart of the sisters that they love. We must get rid of these inequalities. Black women have higher levels of heart disease. Something like CPR administration is really an important thing that we urge everyone to know. You may not be aware that about 350,000 people a year have an out-of-hospital cardiac arrest, and fewer than 10% of those people survive. So through the Nation of Lifesavers campaign at the American Heart Association, we work to fix that problem by making sure that CPR is widely administered. But women should be very upset to know that CPR is administered less in women than in men if in bystander situations, and less in persons of color than white persons in bystander situations.
Why is that? Is that because of a bias?
We assume there's a unconscious bias that could be going on, and there's also just systems of care. We have to make sure we double down in communities where there's a disproportionate risk of heart disease, to make sure things like CPR training is widely available, that access to healthcare is widely available.
You know, wearable health is a very big topic today. I chatted with Dr. Lauren Chung from Apple. I'm going to chat with Tom Hale from Aura in a few minutes. You know, how does the American Heart Association view wearable health, but also other new technologies like AI? I know wearable health, there's so many preventative health benefits from, you know, wearing one of these devices. How is AHA viewing that?
We have long believed that wearable health technology is a game changer for individuals managing the risk of heart disease and of having a stroke. Way back, I remember when wearable health was just something people were talking about, we created a Center for Health Technology and Innovation at the American Heart Association, because we know what really matters is getting gold standard science, you know, into wearable technologies, so that the devices that people may have access to as consumers are tracking the appropriate things and using the appropriate science. So we are very bullish on wearable technology. One of the things that matters to us is the affordability and access of wearable technology. We want to make sure that wearable technology reaches all people that are, you know, that may be at risk of heart disease or of having a stroke. But we think it's really important. And on the topic of AI, I agree with Dr. Besser's comments. You know, there's a lot to be excited about if AI is implemented ethically and appropriately. We actually recently completed a large study of AI in cardiovascular disease science, research, healthcare delivery, and consumer access. And the ethical use of AI is what really matters. You know, we think about healthcare delivery in AI and how it might administratively help support a more efficient healthcare system. Yay, we need that. There's marvelous technology that is being implemented to actually detect a person's risk for something like valvular heart disease long before they knew they had it, because AI tools and algorithms can study blood tests and imaging tests and highlight to healthcare providers people who might be at risk for certain cardiovascular conditions. That's amazing, because if we can get at the front of it and help these people have access to the right technologies to manage their disease they may not have known they even had, that can be a game changer in technology and healthcare delivery as well.
We're here in Washington today, obviously. What policies or what areas would you like Congress to address in order to reduce cardiovascular deaths?
Well, you know, number one on the list is access to high-quality health care for all. We have heard many of our speakers earlier today speak about the fact that if we limit access to people, we will pay a consequence for that. People in rural America, persons in communities that perhaps don't have access to high-quality employer-sponsored health care, as examples, you know, their health risks can increase, and that really matters. The NIH research we've spoken about already. I was very happy to hear the senator speak about food as medicine programs. You know, the American Heart Association has fought for healthful food programs for decades, and as a matter of fact, right now, we and the Rockefeller Foundation have a large food as medicine program where we seek to create the definitive evidence to prove that food as medicine programs, when implemented for certain populations in certain environments, can actually improve health outcomes and reduce costs. And it's really a behavioral economics approach to food as medicine programs. We're very excited about these, and we believe that implementing them can help more people have access to healthful food products, you know, which is a real rate-limiting step for the health of individuals in this country, is access to healthy food products.
We only have a few minutes left, but we started on a positive note. You mentioned that since the American Heart Association was founded, the cardiovascular deaths have been cut in half. What are you most hopeful for going forward?
You know, I'm hopeful that we can continue to inspire people to care about their health and to understand that so much of a person's health is in their hands. You know, what we eat, how we get physical activity, you know, those things really matter. Social connection to people, getting enough sleep, you know, these are things that matter. Yet at the same time, you know, there's a lot to change in the environment because access to healthy food isn't the same for all of us. Safe places to exercise and play are not available to all of us. So I think as individuals and as organizations, we must continue to be the voice for the voiceless and make sure that we are creating public policies that allow health and well-being to be something that can be enjoyed by all.
Nancy Brown, thank you so much for joining us today.
Thank you so much.
Appreciate it.
Thank you.